was onset diabetes at the age of 18, and I was diagnosed with end-stage renal disease at the age of 34.
Initially, I was told I had type 2 diabetes, and then I found out later that it was actually type 1.
My mother and I have been taking care of my father for the last 12 years since he was diagnosed as diabetic.
My in-laws have diabetes and kidney disease.
Adapting to my diagnosis required significant changes in my daily life and routine.
Not knowing anything about diabetes and how it would affect my lifestyle in the long run, it took a little bit of adjusting. I adjust my foods, I adjust my daily living.
As a caregiver, it's natural to feel anxious about not knowing what might happen in the future.
It's challenging taking care of family members who are suffering, but it's also a privilege to support them.
My family is a constant source of encouragement, celebrating with me when I tell them I've gotten a good report, my A1C is down.
The support that I received comes a long way with family, with doctors and nurses and the dietitian from the dialysis center.
It's so important for people to share with other people and not just do it all on their own.
Lean on your friends for emotional and mental support.
It has been a learning journey for me, constantly educating myself and seeking advice to ensure he's on the right track.
Learn what carbs are, good carbs, bad carbs, good sweets, bad sweets.
Incorporating daily walks, especially with my son, became an important part of my routine.
For my father-in-law with his diabetes, we have to make sure that he eats and checks his blood sugar, also going to his doctor's appointments to ensure that his medication is right.
I learned and I took it day by day and just lived a normal lifestyle that I could as much as possible.
Remember that small steps are progress.
Just basically keeping a healthy mindset.
Even if you don't have diabetes, be proactive, get regular checkups.
And get the education. I tell patients, educate yourself on your body because we're all different.
My advice to other caregivers will be stay patient with your patient.
Be patient with yourself. You are going to make mistakes along the way.
And educate yourself about the disease, especially regarding the diet and the medication.
It's not always easy, but the small successes or victories that you go through are rewarding.